Hey, it's Dr. Thornell with New England Family Chiropractic, and I want to share with you today a couple of different things. Number one, I want to share with you some bright spots inside the numbers that are going along with the coronavirus and the pandemic that we're in the middle of here. If you look inside the numbers, there are some bright spots. There's some positives. I've gone through a lot of information, and I've tried to pull out some things to, again, give you the positive information in what's in here and help diminish the fear that goes along with everything that we're seeing. So some of the bright spots, and give me a minute to get to the bright spot. Not everything is bright. Obviously the times that we're in, especially in the United States, are pretty grim when it comes to the coronavirus and people who are dying from it. So I have to mention some of the numbers and some of the bad, but help you then to see the good. So bear with me through this. And I'm just going to walk you through a little timeline that when the coronavirus, when the pandemic left China and started to sweep the world, the Royal College the Imperial College in London put together a model. They had a researcher by the name of Neil Ferguson put together a model to show what's going to happen as this virus spreads around the world. And Neil Ferguson originally said 500,000 people within the United Kingdom were going to die. He said that 2.2 million Americans were going to die because that's what his model showed. About 5-6 days later, he revamped his model and his predictions, and his prediction at that point dropped from 500,000 within the United Kingdom down to 20,000, and that 20,000 on last Friday then dropped to 5,700. So yes, 500,000 is a very scary number, and even the 5,700 to have 5,700, almost 6,000 people die, it's a bad thing, and don't in any way let me get the idea that I'm downplaying the fact that 6,000 people die. It's not a good thing. But it's way better than 500,000. So when we're looking for positives, that's a positive. Those numbers within the United States went from the 2.2 million down to 200,000 to 100,000 to 80,000. Now the latest view was 60,000 or less. Even Dr. Fauci himself in the New England Journal of Medicine towards the end of last week, he said, "It appears as though the overall consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza with a death rate of approximately 0.1%, way less than the 4% that anybody had estimated when this all started." So again, another positive. We're seeing the numbers, the seriousness of it go down. It really at this point is more of like a severe flu season. In Germany, their International Journal of Antimicrobial Agents said they did a study, and their preliminary results of the study can already be seen today and lead to the conclusion that the new virus is no different from traditional coronaviruses in terms of its dangerousness. So yes, there are people dying, but the thing we have to remember is that people die every year from all sorts of respiratory and other infections that they get, the flu being the most common, and the flu numbers will still eclipse what's happening with this year. In addition, the numbers that we're seeing, and leads me to one of my next topics here, is some new frustrations. Some of the numbers that we're seeing are inflated numbers, and there's no other way around it. Now, why that's happening, I don't know. It's that part is very frustrating. But Dr. Birx herself stands up there in the Corona Task Force, and she'll say, we are very, in her exact words, we are very liberal in the recording of corona deaths here in the United States. If people die with the coronavirus, but not necessarily from the coronavirus, they are being recorded as a coronavirus death. So the numbers that we're seeing, even though they're coming down, they're still blown up and not actually accurate. Guess what's happened to heart attack, stroke, cancer deaths, flu deaths, other respiratory deaths that typically make up the highest part of our death rate in this country? They have all absolutely plummeted. It's almost as if all those things have disappeared, and obviously that's not the case. What's happening is those people are sickly to begin with. They're dying, they happen to have coronavirus because they're in the hospital with other people that have it, and because it's a viral infection. Viral infections are everywhere. It doesn't mean that they necessarily kill you, but we can certainly test positive. If we were to test the entire population of the United States for a cold virus right now, there's a whole bunch of, millions of people that would test positive. They may have no idea that they even have it. Now, obviously, that's less severe than the coronavirus, but you get the idea. People die, and the death rates of all those other diseases are off the charts low. Never seen anything like it. And now coronavirus is the top thing. One of the reasons that may happen, I do know that Medicare will pay hospitals $13,000 for every corona patient that they're taking care of. If they're put on a ventilator, they're paid $39,000. So they have some motivation financially to list people as having corona if they're in there with pneumonia or the flu or anything else. That's a frustrating thing. So the next thing that's frustrating and really leaves you sort of bewildered is why the media continues to want to pump up the coronavirus and scare people. I've said before, the media is all about their own bottom line. They want to create people who get stuck to the TV and they never leave, so that their viewership is high and they can tell advertisers, we have X number of people that watch our channel all day, so it's in their best interest to do whatever it takes to keep you locked into that channel. So they're going as far as, I'm sure lots of you have seen this woman who was, she was she was shown on CBS, the nurse who had to quit her job because she didn't have enough protective equipment and she didn't feel safe in there. Now, again, I'm sure there are nurses like that across the country, and I feel terrible for them, and I hope they get the protective gear they need. This one that was on the news, she's been proven to be a complete fraud and had quit her job over a year earlier, yet CBS takes her story and runs with it and puts her all over the nightly news, and she's all over the internet crying about how she doesn't have protective equipment. This was a story where initially CBS, again, they were at the epicenter in New York City, where they didn't have enough ventilators. Just to clear something up, respirator is something you wear on your face when you're ripping down hazardous waste and that sort of thing, and you might use it as you walk through a hospital. The ventilator is the machine that people are on that was supposed to be life-saving, which we're going to talk about in a minute. So they're in the epicenter in New York, and they show footage of all these different people on ventilators and how they can't keep up with it. Well, it turns out that the picture and the video that they're showing was actually from an Italian hospital where, they were struggling at that time, and their emergency room was full, but it wasn't even in New York. And they're showing, here's how bad it is. Here's our war zone in New York, and it's not even New York. Now, if that wasn't bad enough, just 3 days ago in Boston, they used the same footage to show how bad things were in Boston. It's just ridiculous how, and I've heard a television producer talk about this. There's no way that video footage from Italy is mistaken for New York. It says right on the footage, Italian emergency room, whatever, and it passes through about 7 different people, in this producer's opinion, that have to clear that footage before it would ever go on TV and be said it was New York or Boston. So it's intentional what they're doing. They are trying to scare you. They're trying to be as sensational as possible to keep you plugged in. So if we're looking for a bright spot in this sort of garbage, the bright spot is it's not real. It's fake news, so don't get caught up in it. Yesterday we participated in a news fast here in the office. We talked to people about Fridays being News Fast Friday. Every day should be a news fast. You want to get actual news, it will come to you. If there's something that's very important and it's an emergency, something's going to buzz on your phone, or you're going to hear about it. There's no way that you're going to get through the day without knowing that something really serious has happened. There's enough technology that you're going to find out. But the ABC, NBC, CBS, all those news channels, shut them off, or get this much of it. Get your 10 minutes a day of the things you need to know and shut it off. Don't let it just be in the background and destroy your brain and your stress levels and everything else. It's just not worth it. So the next thing we want to go to is, who is actually vulnerable? We talked about how the numbers are decreasing. So who's actually vulnerable? They would love in the media to make you sort of feel like everybody is vulnerable. And have there been cases where there's a 30-year-old who seems to be in good health that ends up getting sick and dying from this? There are, but the numbers are extremely small. In Italy, and Dr. Burke says we are following what happened in Italy to a T. So in Italy, we know that 99% of people who died from the virus had what are called comorbidities. They had other underlying conditions that were likely, and this sounds cruel, but it's true, they had other conditions that were likely to have killed them in that time period anyway. So if you're not somebody who is already extremely sickly or elderly, most of these are 80 plus years old, then it isn't much of a problem for you. If you're a healthy person, when they boiled down the numbers in Italy after all this is over, it's about 12%. Let me read the exact quote here. On reevaluation by the National Institute of Health, only 12% of death certificates have shown to have a direct causality from coronavirus. So 99% of them had something else going on. We boil it all down. Even in the elderly, only, out of everybody that it affected in Italy, about 12% of those that were attributed to coronavirus were actually killed by the coronavirus itself. So we're not as vulnerable as the news media would make us feel if we're watching that. And here was one, this was just April 9th, 2 days ago. This is numbers out of New York City, and I know you can't read this from there, but I'm going to read it for you. In the age groups from 0 to 64, so everybody up to the age of 64, if these people had no underlying conditions, the number of deaths that occurred here are a total of 45 in New York City. There were 0 in the 0 to 17, there were 13 in the 18 to 44, and there were 32 in the 45 to 64. Now, again, I'm not an uncaring person. I feel bad that those people died, but I don't want you to run around in fear of something that has killed 45 healthy people in New York City in the last 8 weeks. Think about the numbers in New York City. That's unbelievable. The risk of those people, the actual chances of those people getting sick and dying is extremely small. Part of the reason that they're dying, and this leads me to my next sort of frustration, is the treatment that everybody said right away, here's what we have to do, may be part of the reason those people are dying. What they're seeing in the emergency rooms is people who can't breathe. They're not getting oxygen, and the body obviously needs oxygen. Our tissues need oxygen. Our brain needs oxygen. Without it, we will end up dying. So the typical treatment for somebody who needs oxygen and isn't getting it is the ventilator. So what this leads me into is people who were just flat out wrong about the situation. Now, why is that a bright spot? The bright spot is because now we know they were wrong and we can start to do things differently and better. So anybody that's affected by this into the future is going to have a better chance of coming out of it. This was Dr. I'm trying to remember his name. Cameron Seidel was his name. He's an emergency room doctor in New York City, treating hundreds of people, and their process, the way that they go about dealing with coronavirus is set in stone in the hospital. If they come in with this, their oxygen saturation drops to a certain point, then we have to do this, then this, and ultimately it ends with the ventilator. So what they're seeing was people come in, their oxygen levels drop, and in his words, and he has an absolutely stunning interview. If you go on, just go into Google or YouTube and put in Dr. Cameron Seidel and watch his video that he made. He'll give you goosebumps. I have goosebumps right now just thinking about the video. How he's describing what he's seen. He has a couple of videos now. And the first one, you can tell he came home from the hospital. He's sitting in his kitchen and he makes this video saying, we're doing it wrong. What we're seeing, what we're treating, what we're told to do, the protocol for this is not what these people are presenting with, and I'm afraid we're killing them. It's an amazing video. So anyway, what he's saying is they're expecting people to come in with pneumonia type symptoms, that their lungs are filling up and they can't get oxygen in, that they can't breathe. And none of that was true. So what they were then doing is taking people who could breathe and forcing air into their lungs with a ventilator, which causes, with the pressures that they're pushing the air in, it causes damage in the lungs and probably sped up the damage to the lungs and caused people to die. Ultimately, what he was saying was, we're not seeing pneumonia patients. We're not seeing acute respiratory disease, acute respiratory symptoms like we would with pneumonia, which is what we were told this is. What we're seeing is people that look like they have altitude sickness, people that look like they're in an airplane 30,000 feet in the air, and there's a leak in the plane and they don't have enough oxygen, that the oxygen just isn't present. He was saying he was talking with people and they're talking back with him and they're breathing just fine, and he's watching their oxygen drop. And ultimately what we're seeing now is that the hemoglobin, and this gets a little bit technical, but bear with me, the hemoglobin within the cells, your red blood cells have hemoglobin that binds oxygen, and then the red blood cells carry oxygen through your body. The hemoglobin is being destroyed by the virus and it's no longer able to hold oxygen. So these people, they weren't having difficulty breathing. There wasn't a problem with their lungs. The problem is oxygen isn't going through their body anymore. It's not connected to the red blood cells. So his approach then was simply giving people oxygen, and that's moved to the nasal cannula, a mask, hyperbaric oxygen chambers, and just getting plentiful oxygen into these people gave them much better results than intubating them and trying to force them with a ventilator. What they're finding now when they go back and they look at it, putting people on a ventilator was almost a death sentence. Now you might say, well, they were the worst of the worst and that's why they got there. Well, they've done things differently in other areas, and that's not the case. There's a doctor by the name of Didier Raoult, who in France, from the very beginning, said oxygen and the hydrochloroquine, and then he's added in hydrochloroquine and zinc. He's now treated over 1,000 patients with a 99.3 success rate without using a ventilator. Over 1,000 patients he's seen. He had 4 that were hospitalized, none that have died. The positives are out there. We just have to look for them. There's another one, I'm trying to think of his name. I had it written down somewhere for me up here too. Doctor in Los Angeles who has seen thousands again, and staying away from the ventilators ultimately is a good thing. And then the other thing that is promising is the hydrochloroquine. I talked about Dr. Raoult, the doctor in Los Angeles. That's getting way more attention. What they're finding is that somehow the hydrochloroquine opens up the cell walls and allows zinc to get into the cell, which helps with the binding of the oxygen and the hemoglobin. So there's definitely something to the hydrochloroquine. The results with that have been spectacular. And the only knock on it is people are saying, well, what about safety? And hydrochloroquine has been around for over 75 years. In much of the world where malaria is a problem, it's like seasickness patches. You walk into the pharmacy, you get a bunch of them, and you use it whenever you need to. It's like candy in the countries where malaria is a common thing, from what I'm told. People just have it. It's all over the place. It's been around forever. It's used in some autoimmune diseases. The safety, yes, you could go overboard and create some problems, but it's one of the least common safety issues among pharmaceuticals that are out there. So to think that some study needs to be done before people can use it when they're already on death's door is ridiculous. At any rate, hopefully some of that news, and I may have been a little bit scattered with it, but getting inside the numbers and getting the real facts should always make you feel a little bit more confident. There are some bright spots in there if you know how to read it. If you're just scrolling through Facebook and reading the headlines, you're going to be in trouble, because you're going to see people like this woman, and you're going to see stories like this. You're going to hear about the one-day-old baby in Louisiana that died from corona, which was 100% not true. The baby was born 22 weeks premature to a mother who was suspected to have coronavirus, and the baby didn't make it. that's not a coronavirus. So the news will scare you. Stay away from that. And remember that the ultimate best thing, if we're looking for positives, if we're looking for bright spots that can come out of this, the ultimate positive, the ultimate bright spot that can come out of this is there is no doubt that the people who are having struggles with this would have struggles with everything because they are not healthy. They are people who are more vulnerable because of comorbidities, the vast majority of them. So what can we learn from that, and why is that a positive thing? Because those comorbidities, most of those things are preventable. Being overweight, simply being obese, puts you in a higher rate of death, a higher risk of death for heart disease, for stroke, for diabetes, for immune dysfunction, all sorts of different things. Now, is obesity something that we have no control over? Of course not. We have total control over obesity. We exercise, we eat right, we proactively do things that keep us from being obese, that keep us from being in those higher risk categories. So, again, I've said it a million times, your best defense against every disease is to be healthy. And that's not just a tagline, that's not just some little coy saying I have. It's true, it's what has allowed man to live on this planet for as long as man has lived on the planet. The people who are most healthy have a very difficult time having disease. You don't have disease and health at the same time. We have health, and as we lose health, we develop disease. So I hope that you will look at this, look at the people who have died, look at the people who have struggled, and learn from their lessons. They unfortunately didn't have the chance to make those changes in time if they passed from this. You do. If you didn't pass from this, then you've got the opportunity to say, hey, I've got to start eating better. I've got to exercise every day. I need to deal with my stress because we know stress is a very real thing. I've gone through the videos and shown you what stress can do to your immune system. I've shown you what stress can do to your brain. It causes physical shrinkage of your brain. We have to take care of our body physically, which includes chiropractic care. It includes having a healthy nervous system. Without a healthy brain and nervous system, you don't have a healthy immune system. Without a healthy brain and nervous system, you don't have a healthy anything. You go to exercise, you cause breakdown. Without a nervous system to control healing, our exercises isn't helping us anymore. If you eat all the best foods, but your nervous system doesn't cause your digestive system to break down and absorb food properly, then you're malnourished. It's interconnected. We can't continue to look at the human body as all these separate pieces. We have to have the brain, the nervous system, and the rest of the body working in conjunction with each other. So, if nothing else, take from all of this corona pandemic, your time in quarantine, the frustrations we have, the deaths that we've seen, the things that make you furious, and say, I'm not going to let all that happen for no reason. I'm going to be better from this, and I'm going to start with that today. So the sun is shining again today. Get outside, get some sunlight, get some vitamin D, some fresh air, maybe take a nice walk, start with that exercise, throw away the sugary crap food that you have in your house, eat some good fruits and vegetables, do all the things that it takes to start being a healthier person. We're here to help you every step of the way. If you have questions, ask, and just get out there and start making your life and yourself a better version of you today.